Hi, Tonya.
Hi, Marie.
I'm so happy to have you here. I mean, it warms my heart that you said you would come on and have a conversation with me about yoga therapy and specifically yoga therapy and palliative care.
Okay. Well, thank you for
Yeah,
having me. I'm so excited to be here.
thank you. Okay, so pretty much what I've been asking everybody as they come on is what their yoga therapy or their journey to becoming a yoga therapist was.
Okay. Um, let's see. I'll start back in the day, at the beginning.
Okay.
When I had my first son, who is now 21, Jay, I went through a really rough battle with postpartum depression. It was kind of like the anxiety and I think about it now as like complete dysregulation hit me really
Mhm.
hard. And fortunately for me, I had an OB at the time who was like, I think that you're suffering. And I think that you need to do some things to take care of yourself, not just your family and your new growing family. Before we try medication, and we actually ended up trying medication and yoga. She said, I really would love it if you would just go take a yoga class, give yourself 1 hour out of the day, a couple times a week and see how you feel. And I had never taken yoga before. I had actually did one prenatal yoga class on a VHS tape in my basement. And I was like, I can't do this. What is this? Um, and I ended up taking my first class at the Y, gentle yoga at my local YMCA. And it was at the very end, in our final resting pose that I felt my entire body, mind, just release.
Mhm.
And I felt like, holy cow, there's something here. There's something to the breath. There's something to the community. There's something to getting out of my house for an hour and taking care of myself. Um,
Mhm.
and I kind of never looked back. At that point, I started going to yoga a couple of times a week, took breaks here and there. And then I was working in nonprofit for many years. I was in nonprofit management for about 18 years and thought, you know what? Like everybody, I'll go take yoga teacher training. I'll deepen my practice. I never want to teach. And I took teacher training at a local studio that I loved and fell in love with that. From there, I just continued to practice for a couple of years. Um, Took another little hiatus. My kids were growing up, and then I ended up going back and doing some pediatric trainings because I wanted to be able to kind of do yoga with my kids.
Mhm.
And I loved that. I was doing like the typical, pajama yoga on Friday nights at a local studio and things. And then I took a career shift and decided to stay at home for a little while and do some nonprofit consulting. And then I started teaching public yoga classes. Never thought I would do it, but I actually really fell in love with, again, for me, it was like the community that it built. Went back and I did a 500 hour in Ayurvedic yoga, which that was really like my introduction into, I don't want to say medical yoga, but more of the understanding of like root causes of
Mhm.
things and how yoga could be beneficial for those. Um, and at that point, I was kind of hooked. I started working with a local nonprofit that I had been involved with previously called Unite for Her. And they serve women with breast and now ovarian cancer. And the idea of working one-on-one, I had done one-on-one yoga, at the studio and things, but the idea of working therapeutically with individuals one-on-one and really using tools to help develop, body awareness and to kind of even talk through, where are you feeling sensation in your body? Where are you feeling the heaviness or the grief or the fear that all these women were going through at the time? I was like completely hooked. So I started really looking into there's got to be more to this, you know. Is there a deeper study? Is there another 300 or 500 hour I should do? And I, did a couple of different modules for things. And I had continued to work with kids. I do love working with kids. But I didn't like the idea of kind of playtime. I wanted to connect with them on deeper levels.
Yeah.
And I saw that really through, I had a teen circle that I ran once a week. And, young girls were coming in with like stress and anxiety. And, I just saw in the time spent with them how beneficial the community piece was, but also the working through your body and, talking and feeling accepted and included. I know I'm rambling.
No,
But
not at all.
I ended up just on Indeed one day. It seems like such a crazy thing, but I saw that the local hospital here in Philadelphia, Children's Hospital, was hiring for a yoga instructor. Um, and I was like, wow, this is incredible. Like, I understand these things. I've worked with kids. I have this training. Went and applied for the job. I was like, I am a perfect fit. I'm a shoe-in. And then I didn't get the job. And they ended up hiring she was wonderful, but she was actually completing her yoga therapy certification at a
Mhm.
local place here. She was a high school teacher. And fortunately for me, this summer that she worked at the hospital, she kind of was able to like see the resources that they had, what they were missing. But then she was offered a full-time job in the public school system. And they called me and they said, this position is open. What do you want to do? And I jumped on it. So that's kind of like how I ended up here. But as soon as I got into the hospital setting, I realized I was in way over my head. And that's when I started, talking to people and putting feelers out and really kind of learning that in order for me to be successful, and I really felt the program to be successful, I needed to do a deeper dive. And I stumbled upon there's a local program that is really close to me. And then I ended up doing my yoga therapy training at Maryland University of Integrative Health together. We were together. Um, and I kind of began to learn what is yoga therapy and how can we implement that in the hospital setting while I was doing the job. So
Right.
the two universes sort of collided in a way. And I ended up pursuing the master's degree because my boss at the time said, if you ever want to do research, if you ever want to, teach, maybe go, the hospital setting is very academic, maybe go for the master's degree if you can swing it. And I did. And thankfully, I learned so much in that process that we were able to bring that into the hospital setting. So,
That's awesome. Wow. It sounds like you were going through a lot of trainings in between all of this too.
yeah.
What are some of those certifications, trainings, licensing that you
Yeah.
might have?
So I'm a Reiki Master Teacher. So that is something that I also can bring into the hospital setting. I'm currently working both within that institution as well as privately, teaching and training things on Reiki. Um, I
Do
went
you want to
to
share a little bit of what Reiki is before?
Sure. Oh yeah. So Reiki is a type of energy therapy. So it's really working with the energetics of the body in its very simplest form to help find and create balance. So it's
Mhm.
nothing that the practitioner is doing with the client or patient. It is really about that individual being open to the idea that Reiki or energy, your body's own energy system, will balance itself
Mhm.
through things like Reiki is a very light touch to a hover, hands on or off, so it can be very trauma informed. It is very trauma informed practice, but it's really again about bringing the nervous system back into balance. It's lovely in like the day hospital setting when you're receiving chemotherapy to have the Reiki practitioner be able to, help ground you, maybe do a little breathing, and then you get this this treatment, for lack of a better way of saying it, that helps your body just relax. So I think that it's a way that at least I've seen it with the chemotherapy patients, they might still be nauseous, right? They might still be having the side effects they're receiving from the medication, but their energy level is more grounded. So they're able to tolerate things a little bit better. Yeah.
Thank you for sharing that. Just in
Yeah.
case anybody was like, what's Reiki?
Gotcha.
Okay.
Um,
So there's more trainings in there too.
oh yeah. What else? So I'm a certified reflexologist. So, I do provide reflexology to patients, in the hospital setting. Reflexology is great. It's a great tool. It's that hand and, specific hand and foot pressure points. Similar to acupressure, maybe a little different in that we really treat like the whole hand or the whole foot, and then focusing on areas where we might need a little bit more attention. It's great. It's a great relaxation tool. I love it at the end of Reiki.
Mhm.
Again, it's great in the hospital setting because it's something that I'm not a massage therapist. I do have some pediatric massage therapy training that I can incorporate at the hospital, but I feel like it keeps me within kind of my scope and my zone.
Mhm.
And it just allows, again, to bring on that level of relaxation. It's also something that is great to teach to patients and clients because they can do
Mhm.
self-reflexology. It's great for
Right.
things like peripheral neuropathy, pain and discomfort. It's a great body awareness tool. So, uh,
Awesome.
yeah. And then throughout my time at CHOP, I started in behavioral health, and then I kind of moved into oncology. And now I work with the multidisciplinary integrative oncology team. Um, but I was not expecting or actually prepared for the level of grief and sadness and, quite honestly, death that I was experiencing, or my patients and families were experiencing, and I was present too. So I ended up doing an end of life doula training through University of Vermont. And I did it originally more because I needed to learn some soft skills to feel
Yeah.
better prepared as a yoga therapist to sit in that space. Um, and I cannot tell you how beneficial that was for me. I think one of the most daunting areas to work can be within palliative care. But it's
Yeah.
also one of the most beautiful. And that is really where I tend to, I don't want to say gravitate to, but I feel like I can make the most difference in my presence. And that training was really instrumental in that.
That's wonderful. And it sounds like you have a little bit of an Ayurvedic background.
Yeah, so I did training as an Ayurvedic Yoga Specialist, which gave me really kind of the background to apply Ayurvedic principles when creating yoga protocols. I
Mm.
expanded on that in my studies at MUIH, but that was a really heavy duty program that I just felt really empowered by. I think so many times in kind of like the Western medical model, we treat symptoms and we just treat them and treat them,
Right.
right? And the
Mhm.
Ayurvedic model is really more about let's get to that root cause. And I think, Ayurveda is the science of yoga, right? So really finding what is that root cause and how can we use these tools to be able to address that. So,
Yeah, exactly. So that kind of opens up into this area of the difference between yoga and a yoga therapist,
mhm.
because you just said something right in there that went, yep,
Yeah,
that Ayurvedic piece. So the difference between a yoga instructor and a yoga therapist.
great question. I could give you like the canned answer, right? I think for me, I want to start by saying that there is a space within, even in the hospital setting, that
Mhm.
both are important. We utilize yoga instructors at CHOP, and then we
Mhm.
utilize yoga therapists. when I was teaching yoga as a yoga instructor, and even now, if I go in and just teach a general class, I am still a yoga teacher. I may not put a therapeutic spin on that. Um, we're teaching we're teaching a class maybe that is going to focus on balance or strength building or restorative, whatever that might be. Where a yoga therapist, first and foremost, I think becomes a clinician, right? So we're really looking at working with individuals to help co-create, really empower them to decide
Mhm.
what their goals are, and then using the practices of yoga, help them meet those goals. Of course, the training is different, the education is different. And I think I'll always kind of be a student trying to expand on knowledge. But I really think it's about that partnership, and that's what makes us therapists, right? It's not just about me having, six people in a group stand up and follow a sequence. It's meeting with them individually beforehand. This is if you're doing group yoga therapy, talking about what goals are, what is the shared commonality. Maybe it's a group for breast cancer, or it's a group focusing on grief. And what are the goals? What do we want to kind of take away from this practice? And then how can we measure progress towards those goals? And we always want our
Right.
clients and patients to really be successful. So sometimes I feel like what we give them as therapists, as yoga therapists, is even more simple than what they might take out of a 60-minute class. But we're hoping that that partnership is that they are practicing these tools at
Right.
home in between sessions so that they are progressing towards their goals.
Yeah. And one of the things that I want to point out too, is that we get to look at the broader picture, you know, in a class, like you said, there might be more of a focus. Whereas a yoga therapist, we are working collaboratively, we are looking at the bigger picture. And that to me actually is one of the most amazing things about being a yoga therapist is that
Yeah.
we kind of get to look at everything and not take things apart, not isolate, but rather support and bring into a client's awareness multiple aspects and multiple tools they
Yeah.
can work with.
I think when you're saying that, I think what really also differentiates us is the intake and assessment process. So as yoga
Hmm.
therapists, we're using the Panchamaya Kosha model. We're using the model that looks at all of the different layers of the body and
Yeah,
how truly interconnected they really are, and how you may walk in with pain, and we're going to look at maybe the physical body, but where is that pain impacting your mental and emotional health? And how can we work with that client who presents with this physical pain and maybe this, energetic, disordered energetic pattern or sleep pattern, or even, grief or sadness or depression or whatever it might be? How can we kind of give them practices that are going to make a positive impact across that whole person, not just in one focused area? So,
hmm, yeah, exactly. So at CHOPS, you're obviously working with children. Do you want to share a little bit about how you work with them?
yeah. So we started the program back in 2017 and went through a lot of growing pains. And when I
Right
was,
before COVID. That's coming
yeah,
into
oh
COVID.
yeah, right
Wow.
before COVID. And we really started out working more as yoga teachers, really just going in and providing a safe space to have, a group class, maybe offering like some yoga one-on-one to people, to patients. But when we really quickly realized that we needed to do this on a much deeper dive and look at it.
Yeah.
Pediatrics is a little different. You still have to look at that whole person, but how do you kind of translate that for kids? And a kid or a child at 5 years old is a lot different than a 10-year-old and a 17-year-old and a 22-year-old. Um,
Yeah.
So, we were offering yoga on a bunch of different units. So we were kind of like, I don't want to say piecemeal, but we were testing the waters, and we started to decide to get really focused. So we focused
Mhm.
our efforts within adolescent behavioral health, gastroenterology, and later in oncology. And I work my peer, Maureen Heil, who is also at CHOP as a yoga therapist. She really loved that behavioral health area, and she shines there. And I loved the oncology piece. And I still love that piece. So we're a consult service now, kind of like a palliative care team would be, or a physical therapist, where a frontline clinician, a physician, or an
Mhm.
advanced practice provider will place a consult. For my team, the Integrative Oncology team, they'll place a consult for, you can do yoga therapy, massage therapy, or acupuncture, energy
Mhm.
therapy. All three of us are practitioners of Reiki. Um, and then we have some things that we're all also kind of cross-trained in that we can provide. But I have a list of patients. Our team tries to really kind of get in front and meet patients at diagnosis. And then we're really able to kind of follow them throughout their cancer journey. So I see kids both in the inpatient setting when they're in for an admission, whether that be a chemo admission, if it's a solid cancer, through surgery. And then also I get to see them in the outpatient setting when they're coming in for day appointments. And we follow them all the way through maintenance, or potentially through end of life. Um, and I think with pediatrics, especially, it's really always changing, and kids are so incredibly resilient. I had a
Yeah.
child earlier this week who was like, I'm so nauseous, Tonia, what can I do? And it's like, let's try our humming breath, and they pause, they may throw up, and they get right back into it. Um, but I think that, the true space of yoga therapy within the pediatric setting, all of our practices can be therapeutic, but I have seen the most kind of, I don't want to say return on investment is not the right word I'm looking for, but the most kind of buyback and adherence to protocol with older adolescents. So 13, 14, 15 on through their 20s, because they get it and they see that these subtle practices give them back kind of a sense of control. And
Right.
they're willing to do the work, which is just amazing.
It sounds like because they have the ability to see and connect the dots that these practices are actually helping,
Yeah.
that they can actually feel a bit of empowerment. Is
Yeah.
the Yeah,
Yeah. Me too.
autonomy, like they can start going through and going, okay, these are the things that I can do to help the process that I'm going through.
Yes.
And those are some lifelong skills too, right?
Yeah. I mean, I think when you have a child that is ill, so much of their entire life is outside of their control, and
Hmm.
even outside of their parents or caregivers' control. And these practices give them back a sense of empowerment and resiliency. And it is also about the co-creation of goals. I'm not going in and saying, today we're going to work on this. It's
Hmm.
like, first, let's have a
Right.
conversation. And it could take weeks really to build relationship. And I think that's the other big piece about, our role as yoga therapists. Um, we're nervous system regulators. We are a comforting ear. We're a hand that you can hold. And, while we have a scope of practice, it's really, and I think I've seen this in my work, it's really about holding space for people to be able to just share what is happening right now, especially in the hospital setting. They don't get that opportunity very often. I know what our goals are. I know what we're working towards, but I don't go in with the intention of, okay, I know you were nauseous on Tuesday and today is Thursday, so we're going to, I might check in about that, but it's always, who is showing up in front of me today and how can I hold space for them to explore what is in their
Mm.
body, what they're feeling. So,
And that's such a safe and healing space to be in.
yeah,
It really is.
yeah.
Yeah, I love that. I absolutely love that. And I mean, you're just so warm.
Oh, you're so kind. My
Just
kids,
being in your presence. Oh,
my own kids
I'm
wouldn't say
so
that.
warm.
So, yeah.
Well, I have a funny feeling that they probably say that you're funny too, because you definitely have a sense of humor. Um, okay, so we know where you're working, we know your journey. Um, when you are working with your clients, or the patients, I should say, at CHOPS, how does that differ from, say, working with somebody privately? Because you also have a private practice.
Yeah. So like I mentioned, we're a consult service, so I have a list of patients that is essentially generated by, we do advertise our integrative oncology clinic. We do advertise and we do reach out to new diagnoses families. But within the hospital setting, there's also the other partnerships. So, I get to refer to other integrative modalities or holistic practitioners. I work really closely with psychologists, with social workers, with the child life specialists, art therapists, music therapists, to really make sure that a child is supported mind, body, spirit.
Yeah,
And I'm really fortunate that my role encompasses mind, body, spirit, right? So I'm not just coming in and looking at pain per se or mobility. That could just be a piece of it. In the private practice world, um, I should also say within the hospital world, there's a lot of paperwork. you know,
yeah,
there's there is a lot of ensuring that you are really utilizing the evidence base as best as you can, and also being able to back up your practices with that knowledge of, what is an evidence-informed practice, which has
yeah,
been great. We've been able to expand into research and things. Private practice, I take all of that still very seriously. But I guess I'm just able to kind of craft more the populations that I am most comfortable and most um in I don't want to say inspired by working with, but where I feel like I fuel my own passion and the tools
mhm,
of yoga really get exciting for me. So,
yeah. And even as a private practice yoga therapist, you still are resourcing out if you need to,
of
correct?
course, yeah.
Yeah.
And one of the things that I talk to my clients about, because I do see adults as well on the outside, is comfort level in terms of sharing with me
Mhm,
what, let's talk about what your primary care physician has said, or what your psychologist is working through. And should I have concerns, are you okay with me reaching out to that individual? Um,
mhm.
and we have consent within the hospital. We also have consent forms in private practice.
Right.
And I think that's really important. Like we are healthcare providers.
Mhm.
And kind of adhering to those standards is incredibly important, especially for a growing profession.
Right. So going back to consent, can you speak into that just a little bit more? Because I'm not sure that people who are listening again might go, well, why would you want to speak to my doctors? And
Yeah. Well, I mean, if you look at it within the hospital setting, sometimes we create or we walk into a space and we create this shared space
Mhm,
of it's okay to be vulnerable. And it's really okay to kind of share whatever is coming up. As a yoga therapist, I'm always bringing that back to the body. So if someone
mhm,
is experiencing sadness, I might ask them, where do you feel that in the body? And then we might work on some tools to maybe move through that. And then again, talk about now, how do you feel? But very oftentimes you're developing these relationships where things come up. And I think it's really important. So as a yoga therapist, I am holding space. I am working on co-created goals, but I am not providing cognitive behavioral therapy. I'm not creating solutions for my patients or clients. If I see something that is a red flag or even something that is concerning or worrisome to me, I will reach
Mhm.
out to the primary oncologist or the psychologist and have that conversation. And quite often, especially in the hospital, we're really able to at times co-treat. I've had a couple of amazing, more than a couple amazing experiences working within session with the psychologist. Um,
Mhm.
a lot of our tools or mechanisms for emotional regulation are the same. In the
Yeah,
yoga context, it might look a little bit different. In the CBT context, it's going to look a little bit different. But we're all coming back to that shared space of regulation.
yeah.
And I think where everybody feels they are best supported, I tell my private clients that all the time.
Mhm.
I can't go digging into your medical record. I am trusting that you're going to share with me. However, should things come up and I feel like perhaps you are, you know, unsafe, or if I need to get additional clarification on whether or not you're presenting symptoms, maybe have some contraindications to them that I need to hear more from your practitioner, I need to be able
Mhm.
to have that comfort level and that individual's consent that I then can reach out to keep them safe.
Exactly. I love that. So, part of what you just said, the contraindications, because part of what we do is we do some yoga poses,
Yeah.
so knowing if somebody has, osteopenia, osteoarthritis, you know, knee replacements, joint replacements, like we want to know these things and make sure that our clients are safe. And we're hoping that they bring that to us. But it is nice to be able to have that connection, to be able to say, okay, these are the things that I'm working with. And so that way our clients also do feel safer because then they know that they have more than one support system. And that is one thing about yoga therapy, again, that I absolutely love because, when we are looking at the different, I almost said parts, it's not parts, you know, the different aspects that we look at as yoga therapists, we have these different pillars of support.
Yeah.
And that's what I think is definitely something that sets us apart. And I imagine that in the hospital, um, you might be able to spend a little bit more time with some of your clients slash patients than say their doctor.
Yeah.
Is that correct?
Yeah. I mean, I think that, healthcare today is harried in general, right?
Mhm.
Um, but because I'm not really going in with a set agenda necessarily, I know what we're working on or what we're working towards.
Mhm.
Um, Sometimes just starting the conversation with "How are you today?"
Yeah.
opens up a lot of conversation. Um, and I think that in the beginning at CHOP, I was very concerned that we were coming in as, what's this yoga person going to do? And believe me, we made our share of I don't want to call them mistakes, I'll call them missteps that kind of guided us into,
Mhm.
a safer, more regulated path. We are very, very regulated. Um, and it is a luxury. I have the luxury of spending the appropriate amount of time it takes for someone to feel like they have made progress. So sometimes that could really be 15 minutes with teaching a young child about breath techniques to use for a port change or a dressing change.
Mhm.
A port flush, I should say, or even things like pre-procedural anxiety. It's really scary to drive to the clinic every day when you know that the chemo that you're going to receive that day is going to make you really sick for the next 4 days. Then there is I have an outpatient clinic now. I have my own actual outpatient clinic hours at CHOP, where really highly motivated patients and families can schedule weekly appointments. And they are 1 hour to 90-minute slots. And they go by like this.
Yeah.
On the inpatient side, sometimes I will tell you the demand is so high that we may not get to everyone. I work really closely with massage and acupuncture to make sure that our shared patients are getting the care that they need. If I can't see them one day, maybe massage comes in, or
Yeah.
and we're all really also doing things like basic mindfulness techniques, relaxation techniques, things like that. So we can kind of play off one another a bit. But when I go in, I get to do that deeper dive into yoga therapy. And if it takes 90 minutes and there's a therapeutic benefit, that's really 90 minutes well spent.
Yeah. Well, thank you for sharing that. Okay. So going back to the things that you are doing. So you work at Chops, you have these you said offsite, or is it offsite or yeah.
Yeah, so there's the main hospital where we have,
Okay.
we have like our admitted patients go. We have like a 500 plus bed hospital. In oncology, I think we're around like 60 beds. And then I also work in the day hospital, which is the outpatient setting. So that's for like if you have a 5-day chemo regimen, you're coming in Monday, Tuesday, Wednesday, Thursday, Friday, and then you're
Mhm.
going home. So I'm really lucky that a lot of my patients that come through for day treatment, when they come inpatient, I'm able to be that kind of friendly face. Like, I just saw you Tuesday. I'm so sorry you had a fever. You're in here today. Let's see, how are you feeling today? What can we work on together? So.
That's so nice. Okay, and then you also have your private practice.
Yeah, so I do have a small, I don't want to say thriving private practice now. I started um I started a private practice, whole health yoga therapy, maybe like a year or so ago. And I tend to see people that are referred through word of mouth. I don't do a lot of advertising, to be honest. So if you're looking at my website, you'll see why I need to spend a little time on it. But I just, I'm 30 hours a week at the hospital. My commute is pretty long, and I I'm very kind of like choosy with um that the types of clients that I'm able to take on, because I really want to make sure that I have my own personal energetics to be able to handle them
Yeah.
and provide
And,
quality care.
and there's something else that you do.
Oh, you're so funny. Yeah. So I I
Where else
am
would we find you?
Yeah. So where else can you find me? I am an adjunct faculty member at Maryland University of Integrative Health, and I'm also a clinic faculty member there. And the reason that I have kind of stayed on, and the reason that I love that work, is I love talking like you about what is yoga therapy, and I love teaching really dedicated, motivated people that get these practices are incredibly beneficial for so many diseases, right? They're physically, energetically, mentally, emotionally, building interoceptive awareness, building connection with others. The spiritual piece of yoga therapy, I think, is incredible. Um, so I love working in the clinic. I love kind of meeting and learning from too my students, um, because I do every day, and kind of helping to shape what is the future of yoga therapy in a really small way. But I do feel a part of that. I'm really incredibly passionate about this profession. Where we were, or where this profession was 10 years ago, the yoga therapists of 10 years ago are different than they were. I think our field is growing exponentially. I think that there is so much more research on the benefits of yoga than there was even 5 years ago, and even,
Yeah.
more research coming out for pediatrics. And I love being able to kind of play a piece in the education role there. Yeah.
Yeah. Speaking of research,
Yeah.
uh, so part of being a student, more recent than yourself, we did do quite a bit of research on uh, chronic pain,
Yeah.
neurological issues, disease, right? I know that you just said that, in the last 5 years, you've seen way more research coming into play, but can you kind of expand on that a little bit? And what are the benefits that by seeing this research?
Yeah. I mean, I think exactly what you're saying. I think, evidence-informed practice, right? It's about what does the research show, but it's also about clinician experience, clinician client
Mhm.
experience. In my own practice, both in the hospital setting and outside of that, I have definitely seen and, been experiencing what is working for things like chronic pain. But of course, that's different for every individual. I think that there are more and more hospital settings, yoga therapists in private practice that are partnering um,
Mhm.
to bring forth things like, how does yoga therapy impact chronic pain? How does yoga therapy or yoga, I always think of it as like, how do yoga-based practices um, impact things like the pain caused by maybe like sickle cell disease, right? Or,
Mhm.
um, you know, chemotherapy induced nausea and vomiting, chemotherapy induced peripheral neuropathy. And there's a lot of, you know, great researchers within within yoga therapy, and then healthcare providers within these larger institutions that are really coming together to look at this research, and have been. And, every day something kind of comes across my desk and I'm like, oh my gosh, I have to print this out so that I can read this later. There's a great study that I was just reading, and it's going to kill me. I'm not going to be able to tell you where it's from, but on yoga for head and neck cancer and the
Mm.
benefits. And it's really
Oh,
amazing.
wow.
We were able at CHOP, we did a research study with patients who were suffering from irritable bowel disease, so IBD, and we looked at like Crohn's and colitis patients
Mhm.
and what they were experiencing during pain flares, but also things like the emotional impact of having fear of being too far away from home, right? Or of,
Yeah.
for kids, it's going to school and not knowing, what their day may hold.
Mhm.
And that was a really exciting project to be a part of. We did another study that we ended recently. It started with a feasibility study, and then looking at shift in pain and decrease in opioid use among children getting a certain type of immunotherapy. What we found was that absolutely yoga therapy can help with the distress scale.
Mhm.
It was absolutely feasible within the hospital setting. Caregivers appreciated, learning those tools as well. Did it help with opioid decrease? Maybe a little bit, but our population sample was so small. But what we definitely saw were patient satisfaction ratings increased, pain levels were decreased with that type of physical and emotional regulation. And parents and caregivers had tools that they could then work with their kids when the yoga
Yeah.
therapist was there, which is like, that's the other piece to all of this work, especially within pediatrics, is being able to work with caregivers, because the energetic exchange that takes place between a sick child and a
Yes.
really stressed parent, sometimes working, and we have a little bit of flexibility within our role at CHOP within oncology, that if a child really does not want to do something, of course, that it is as much, it's as much a practice of them having the agency to say no than it is
Mhm.
going in and working on something. But in that same breath, I might say to the parent or caregiver, would you like to experience? Would you like to talk? How are you today? And would you like to do some breathing together? What can how can you possibly sleep on this horrific bed? Let's talk about some meditations for sleep.
Yeah.
Would you like to experience what your child experiences during Reiki? And
Yeah.
sometimes watching the child relax, this is when I get emotional, when they see their parent or caregiver relax, even for 5 minutes, is
Yeah.
such a gift. There's a lot of guilt that sick children carry because
Yes.
they have changed and shifted their whole world. Um, and working through that both from a caregiver as well as a child perspective is incredibly powerful.
Yeah. It was so funny. I was about to ask you about the caregiving piece of it. I'm really glad that you brought that up because, just going into the energetics of, one person and another person coming together, we sense that, and children very much are more aware of that energetic piece. I think as we get older, we tend to kind of nay, oh, I'm not really feeling that, right? Versus
Yeah.
a child, we're like, I'm feeling this, right? And so to be able to give a parent who also probably is suffering from guilt of their own, did they do something wrong? Did they genetics, like what is it, right? So to be able to gift them a little bit of peace here and there,
Yeah.
this has to be such a wonderful gift for both of them because then they can come back together and almost, I would assume, and I'm using the word assume, almost for 5 minutes have a little bit of normalcy in their life.
Yes. That's so perfectly said, Marie. I think that when we do a simple mindfulness practice, right? You actually have 5 minutes or 5 breaths worth of, oh my gosh, I'm back in my body.
Yes.
I can let my shoulders soften. I can close my
Yeah.
eyes. Closing eyes is incredibly difficult, right?
Yeah.
Um, but when we learn and when we are open to the fact that you can access those 5 minutes throughout the day with these practices, that's
Yeah.
the really empowering tool, right? So I
Yeah.
think that sometimes yoga is the way in is through the caregivers. Sometimes it's
Mhm.
through the benefits that they see their children experiencing. But especially in pediatrics, it really is about caring for the whole unit. And
Yeah.
sometimes that includes siblings. And for siblings, when your brother or sister is uprooted and is in the hospital for transplant for months at a time, your parent or parents or caregivers may not be there at home. There is through COVID, oh my gosh, like with no visitors, right? You may
Right.
not see your sibling for months at a time. Um, and it's really scary. So after COVID, when, visitor restrictions and things were lifted, sometimes it falls almost outside of the realm of well, we're working on this today. But if there are siblings present in the room, to be able to, the three of us or four of us, whatever it might look like,
Yeah.
move and breathe and laugh, that is
Mhm.
incredible, right? For a sibling to see their what they are afraid of. We all know, the fear that exists when you have a family member that's chronically ill. When they're able to see them move and laugh, even for a moment, they can take that home, right? Maybe they practice together. Maybe they practice the breathing before they take their fourth grade math test. So
Yeah.
all
And
trans
I believe that's called being present.
Yeah.
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 For a moment, they get to just be present with one
Uh,
another.
yes.
Yeah.
So
Oh,
lovely.
this makes my heart like, oh, thank you for sharing that experience. Um, okay, so going back to MUIH and what you're doing there as well, I'm amazed you have any time at all.
I don't cook a lot of
You're
dinner.
jack of all trades.
Yeah.
Um, so going back to MUIH, one of the things that I was thinking earlier, and I wanted to come back and revisit, because you are on the faculty and you have been a student, you have seen the progression of the program and the progression of the research and everything that's been coming along with that. um, Maybe you have a different vantage point than, say, myself, who was a student coming out, right? I don't have the vantage point that you have because you've been there kind of through, these years of evolving.
Mm.
What would you say you've seen evolve the most?
I think I was really apprehensive um, about moving to an all online platform.
Mm,
And I was really at first worried about um, how are we going to teach future yoga therapists to really look at the body and really understand the mechanics. In our curriculum, we were really heavy on things like muscle testing and physical assessment. Um, Almost, I don't want to say to a flaw because it's so incredibly important. Asana,
mhm,
right? Where are you experiencing this in the body? Um, but the more I thought about, first of all, everything is moving online these days, but the more I kind of thought about it and played around with it in my mind, sometimes as yoga teachers moving into yoga therapy, we stay
mhm,
so hung up on just the physical piece of yoga that those
mm,
other koshas, those other, parts of the system get overlooked. And I think that moving into this online world, we're going to have to
mm,
depend and lean into more of those more subtle body practices and the
mm.
other koshas, right? Um, and I think that that's incredibly important because I would say that it's it is definitely a piece. Movement is an incredible tool for self-regulation. Um, it's an incredible tool for strength building, for relaxation and release, all of these things. But it is not just that. So yoga encompasses so many other practices. Um, and I think we're really making the curriculum stronger to dive deeper, maybe into those other areas, which I think is really exciting. For someone that works with really critically ill clients most of the time where movement may not be an option, I've had to really rely on, the other koshas to kind of dig deeper at what our work is going to look like.
That is actually really interesting because as somebody who was in the hybrid program,
Yeah.
I was thinking the same thing. Like, how are you going to be able to teach this? And then I thought, well, they did it during COVID, right?
Yeah.
So they must know how to do it.
Yeah.
I
And
don't
I
mean
think,
to laugh about it, but I mean,
yeah.
there was definitely like for me. But you really hit a point there for me because the clients that I'm working with, so coming into the program and starting, in the clinic, I probably was doing more of the asana, so the yoga practice. In the beginning, I was doing a bigger portion of that. The other pieces were coming in, but I almost felt like asana might have been a little bit more of the meat and potatoes of everything.
Mhm.
But working in a private practice, yes, I absolutely do that piece, but it's more like, a side salad. I
Yeah.
am addressing so much more of, you know, the different practices of mindfulness and breathing, and you're absolutely right. And I have gone much deeper even in my own practice as well, because I am like kind of moving away from the physical piece. Now,
Yeah.
don't get me wrong. I still, love to teach yoga, and I still do, a little bit of asana, for my clients. But the majority of what I'm working with, you know, is much more around the mindfulness piece and the regulation of the nervous system. And uh, yeah, that's so funny. I didn't even realize that till you said it. It's like,
Yeah, I think that there is a way that we have to, as yoga therapists, learn to look at the musculoskeletal system, right? We're not physical therapists, we're not occupational therapists, we're not recreational therapists, we're yoga therapists. And I need to look at your body and understand how it moves in your activities of daily living and
mhm,
what is causing you distress, right?
right.
So if you had a knee replacement, I need to understand that, and I need to have the knowledge to know what muscles am I going to work with you on strengthening to support that knee replacement, along with your physical therapist, who I hope you're seeing. But what is your goal? Is it to walk pain-free? Well, then let's talk about that. Like, what is your
Yeah,
experience of pain?
right.
Um, and we have to be musculoskeletally aware because asana is a large piece. But it's often so interconnected with everything else. Like, I love when I'm able to even co-treat with like one of our physical therapists, and
Hmm.
they do look at the body in a different way. They have different goals. But so
Right.
often my goals are supporting theirs, or I should say the
Yes.
client's goals, the work that we're doing together are supporting the physical therapy goals.
Right.
And that's just such an awesome partnership to have. And I think that's why I love the hospital setting so much. I love my team. I love being able to like reach out for clarification. I don't know everything. I'm going to call the
Yeah.
PT, and I'm going to call the oncologist and talk through these questions. And that just I feel really supported in that role. So,
Yeah. I actually had a client who went in for a hip replacement, and he's very active. And so he wanted to come in and do some things before his replacement, his hip replacement. And what was interesting is that he later told me that he was also working with another trainer, and he was working with me. This is, pre physical therapy, right? And then he was telling his physical therapist some of the things that he had done with me and the breath work, and the physical therapist was really pleased.
yeah.
So, yeah, we definitely are, again, just another support, another side. And it's, I feel like with yoga therapy, we almost fill these spaces to wrap around a client even more, to
Yes.
really almost seal that container,
Yeah.
that of safety and healing.
Yeah. Well, I mean,
Yeah.
if you think about working with someone maybe on, if a PT might be working with you on, foot drop, for example. We
Yes.
have a lot of our oncology patients that experience that post-neuropathy and things. Um, they got that, right? They're working with that physically. I
Hmm.
might come in and then talk to them about, can you stand in mountain pose and can you feel your body top down? Can you feel your feet connected to the earth? Um,
Yeah.
and how does that make you feel? Can you breathe into that? What sensation are you experiencing? What memories does this bring up? So you're
Yeah.
right. It's like kind of like, we sort of weave in and kind of coat all these other places,
Yeah.
um, with extra goodness.
Yes. Exactly. Extra goodness. Yeah. I love that. I am so happy that you were able to come on and have
Oh,
this discussion with me. It just warms my heart.
anytime.
Um, one of well, two things. Is there anything that you would like to also include? And two, where can people find you besides the show notes?
Um, where can people find me? You can find me. My personal website is wholehealthyogatherapy.com. And you can contact me through that, or wholehealthyogatherapy@gmail.com. You can find me at CHOP. You can find me in the Integrative Health Department. You can find me at MUIH. Um, Hopefully this summer you'll find me at the beach a lot more. Um, one other thing, what else would I like to share? I don't know. I appreciate you, Marie. I think that bringing our profession, we're still growing, and growing in like a really smart way. Um, but I think that we need more people to talk about it. How are we working in partnership with behavioral health, with there's a lot of work going on with yoga now in addiction therapy and recovery. And within kind of, we in the hospital we think of them as like service units, right? Oncology, GI, PICU, rehab. Um, and I think that for a long time I felt in my yoga therapy journey, really like siloed and alone. And then
Mhm.
I almost was like, wait a second, that person, that they shouldn't be doing yoga, right? And then, you kind of have to take a step back and be the subject matter expert in your area and be really
Mhm.
willing and open to partnering and also being part of a team. I would not be as passionate about my work in yoga therapy if I also didn't know that there were other like-minded practitioners out there and other healthcare providers that shared the belief that there are major mega benefits to incorporating yoga across the board,
Mhm.
from well child or well adult, um, all the way through like the dis-ease process. um,
Yes.
and there are, practitioners, there's energy workers, there's massage therapists, there's health coaches, there's psychologists, everybody, right? I think that when you are supported by a team and you're part of a team, it's important. So for all the yoga therapists or aspiring yoga
Mhm.
therapists that are out there that may feel really alone, I had a conversation with such a lovely colleague from the Midwest a couple of weeks ago, and she said, I'm in private practice and I feel really alone. So my
Mm.
recommendation to that is like, get active in IAYT. If you're
Yeah.
working with a specific population, like, for me, it's oncology. I'm involved in Society for Integrative Oncology. I try and like immerse myself in that. Because there are special interest groups within a lot of those larger organizations that are full of yoga therapists, yoga teachers that are really passionate about the work. So you're not alone. I know it can feel like that sometimes out there, um, but I promise you, every day I hear more and more about so and so got a job here, and this person's working there,
Yeah.
and that person has a research study. So
Yeah.
it can feel like a lot of hard work to stay connected, but it's really important. So,
Absolutely. And I am also hearing about where people are moving into these spaces that they're filling. And again, it's pretty amazing.
yeah.
I mean, Marlisa, the VA.
Yeah. I
I
mean,
mean, that's mind blowing to me, the amount of work that she's doing over there.
yeah.
What you do. Um, there's more, but I'll just kind of keep it short because I'll be inviting those people on too.
Good. Oh, I'm so glad. I can't wait to watch.
Yes, I am really excited because of course, I love doing it, but I've been able to see with my own clients, hear from other people like yourself about the work and the benefits of yoga therapy, the many, many benefits of yoga therapy, even in situations that don't necessarily feel um, like there's a lot of hope,
Yeah.
right?
Yeah.
And hence the name of my podcast, The Alchemy of Healing,
Love
right?
it.
Yeah. Um, from emotional, to disease. I think that we're definitely bringing something into the world right now that is needed on so many levels because it is all inclusive, it is collaborative.
Yeah.
Uh, I won't stand too much on my soapbox.
I love it.
Yeah. It was so wonderful to have you. I hope to have you on again. I'd love to maybe delve a little bit deeper into the Ayurvedic piece of
Sure.
yoga therapy.
Yeah.
So,
I'm around. Now you know where to find me.
yes,
So thank you
I'll
for
be knocking
all
at your door.
thank you
Thank
for all you're
you.
doing. Okay.
Thank
It
you.
was great to see you, Marie. Lovely Marie. Always great to see you.
Thank you.